Hi, I'm Maria. I've been working for St Giles Trust for 20 years and I started in Wandsworth Prison. So, St Giles in the 90s, I mean, a lot of people would have said it was a normal day centre, soup kitchen kind of thing for homeless people. Lots of older men queuing up outside the door to get their food. But even back then, St Giles was really innovative and we really tried to take a different approach to homelessness. We did something called Under One Roof, so it meant that homeless people could get all their needs seen to in one building, and we had a dentist on site, we had a podiatrist, we had a benefits advisor, so that people didn't just get tea and sympathy, they were actually getting really valuable advice and were able to move on with their lives through the support they've got. So it was kind of more structured, more focused and more effective. Then in the noughties, things changed even more and we did something which was totally innovative at the time. We were aware that about 80% of our homeless client group were involved in the criminal justice system, and a lot were on that revolving door of prison street. So we actually went into a prison and delivered homeless services from inside the prison before people were released. Our first project was in Wandsworth Prison in South London on a government rough sleepers grant, and we focused on the men who were leaving and were street homeless and worked with them before release to set them up with accommodation when they came out. And really it was the first example of an innovative Through the Gates programme. And that extended, it was very successful, and we went on to do resettlement programmes in other prisons around the country, not just around housing, but also we started to provide advice around general resettlement and helping people get into employment, and it was from that that our Pioneer Peer Advice scheme grew.